My best friend Purnima's son goes to play school, and for a while he has not been going. When I inquired, she said he may have smallpox. But after a few days, she said that he was diagnosed with hand, foot, mouth disease. This has become a very common disease these days, especially in play school and daycare centers, because under the age of 5 is when kids are vulnerable to this disease. And this hand, foot, mouth disease brings in rashes over the mouth, palm, and even foot behind the knee, and these can turn into blisters which can bring in a lot of discomfort to children. This is a very mild symptom, as doctors say, but the irritability is high, and when younger children get caught with cold also, they suffer so much, and we in turn find it very difficult to see them. And hence the video here, I would talk about what is hand, foot, mouth disease, why is it caused, what are the viruses that cause them, what ways can you find out symptoms, diagnosis, treatment and prevention. So my name is Kavitha. Do consider watching this video till the end, which will include all these details. The name hand, foot, mouth disease is a simple derivation for the symptoms it causes on the hand, foot and mouth, the rashes, the blisters. This is caused by the virus Coxsackie virus or enterovirus. Different viruses can also cause this, and same virus, different variants can also cause this. Now this spreads through saliva, mucus or feces, and this is majorly seen during summer or during autumn or fall. This disease is generally transmitted through coughing, sneezing or unclean hands, or when children come in close contact with each other while hugging, kissing, sharing the same cups or same food, and also when in playgroup they change the soiled diapers, so then through feces it can get transmitted, or children touch the same infected wall or floor, or when they play with same toys, it can spread. Symptoms are high fever in the beginning, and then you can observe rashes which will turn into blisters later, especially around the mouth, palm, foot, behind the knee, and low appetite, irritability, also sore throat can be another concern. Diagnosis, majorly observing all the symptoms, doctor will advise medication, or to be very sure he may advise to get the throat swab or the feces tested. The stool test examination can be sent to laboratory, and then post the result doctor will be sure and the medication can be done. There is no specific treatment or medication for hand, foot, mouth disease, because the symptoms are very mild, and within 7 to 10 days they vanish and the baby is cured. But during the period, to ease the discomfort, doctor may recommend over the counter medication for pain relief like aspirin or paracetamol, or because babies cannot or their kids cannot swallow anything, they'll have a lot of pain here, doctor may advise mouthwash or oral sprays to numb the area and decrease the pain for a while. And I would like to also tell you what we can do at home. At first, help them get a lot of rest, less of jumping around, and then request or insist them not to scratch their hands, or the blisters will increase, the pain will increase. And to give them little comfort, you can give them salt water rinse, and also during bath you can add little salt in the bathing water. When it comes to food, you can give them cold, soft foods. Avoid acidic, salty or spicy food. Give them a lot of liquid in the form of water, in the form of homemade juices with less of a sugar, and avoid milkshakes at that time for sure. This is not a very complex disease. It would not cause a lot of complications, but you must know dehydration is one of the major concerns. Because of sore throat or irritability in the mouth, kids would avoid drinking water or taking fluids. Please ensure that you do it. Major complications like swelling of membranes around the brain or spinal cord, brain swelling, heart muscle swelling of heart muscles or paralysis can be major concerns, but very rare. Prevention. The infected child is contagious between 7 to 10 days, so it is advised to keep the child at home, treat him well. And one good news is, once infected, the chances are very rare that the child would get it again, because the immunity would have been built. So if you're sending your child to daycare or preschool, please talk to them, tell them to maintain hygiene there. And if a child is infected, ask parents to not send them to daycare or preschool for a while, for at least 7 to 10 days, until the symptoms are gone. The marks will definitely be there for a while, it's okay, but symptoms must be gone. And also keep your child hygienic. Tell him to keep washing his hands with the water whenever he's come from outside. These sanitizers are to be kept at a bay now. Please use water as much as possible to clean hands. Only during high emergency use them. And at last, I would like to tell you, unlike, just like all other illnesses, your baby would suffer. Because it is visible, you are more worried. So please don't pass on negativity to the child, talking over the phone, telling everybody your baby is undergoing hand, foot, mouth disease. This is a simple tip I would like to give all parents. Yes, babies would suffer. It's difficult for us to see them, but negativity can be dangerous. It will take a lot of time for the babies or kids to get cured from any illness. Even for you, doctor would say, take this medicine, stay happy, you will get cured. Even during major concerns at hospitals, this is what we see in the movies. So take care of it. And during this period, your child may not eat well, not drink well. Fluids are important, but if they are not eating, it's okay. Your major worry is they would reduce their weight during illness, but it's okay. Give them soft food. Their body knows how much they can take and how much they can survive upon. They will take that. And last but not the least, this is majorly observed in children below the age of 5. It can be found in kids below the age of 12, and adults can also contract this. So stay safe, especially pregnant women should stay safe, because any form of fever isn't good for them. Okay, so thank you so much for watching this video. My name is Kavitha and I own a brand called Tots and Moms. This is Tots and Moms Foods, and our products are porridges, cereals, instant food mixes for babies, nutrient boosters like dry fruits powder or nuts and seeds powder also we sell. Sugar alternative like palm jaggery, coconut jaggery, dry dates powder are sold here. For toddlers and kids, we sell pancake mixes, cookies and drink mixes. All the products are USD organic certified, and these are chemical free, preservative free and certified products. So please do consider checking them on shop.totsandmoms.com. We are doing this since 7 years and more, and a group of women are manufacturing this in a well certified utility. Now our products are also available on Amazon, Flipkart, Big Basket and First Cry, so do check them there. And yes, thanks again. If you have any doubts about the concept, the video, you want me to make videos on any other topic, do comment and let me know. Your comments matter a lot. The views have reduced and it's difficult for me to even understand if this kind of topic are running well. So please comment and tell me how you're liking it. Any other topic suggestions are welcome. I'll see you soon in yet another video. Consider subscribing to this channel. Take care. Bye-bye till then.